If you're someone who's suffering from bladder leakage during a workout, maybe this is something you've been dealing for a long time, maybe it's something you've had since your last pregnancy, or maybe it's just something that's come along with age. Did you know that you can actually stop this and have more control of your bladder, and that physiotherapy can help? I'm Jerikka, physiotherapist from SNU, your fitness and therapy experts, and today we're going to talk about urinary incontinence. Many conditions such as low back pain and urinary incontinence consist of four components: your diaphragm, your core, your multifidi, which is your low back muscles, and lastly, the pelvic floor. The pelvic floor is a group of muscles inside the pelvic bone that supports the pelvic organs, such as the bladder. Weak pelvic floor muscles may lead to leakage of the bladder, specifically when you're doing core and the abdominal pressure increases. So are you someone that may be suffering from pelvic floor dysfunction? This may be leakage during training, leakage during sport, coughing, sneezing, or laughing, or just the inability to hold in your pee. So here are some of the reasons why. You've got a weak pelvic floor and a weak core, because every time you contract the core, you're having a pre-contraction of those pelvic floor muscles. I'm going to show you some strategies you can do to help train and strengthen those muscles to gain control of your bladder. So you may have heard to start doing Kegels. However, many times people are not doing them properly. I'm going to show you how to do them correctly. So you're going to lie down in a comfortable position and close your eyes. Imagine you're peeing. Visualize those muscles, the pelvic floor, as a hammock. Now you're going to squeeze those pelvic floor muscles and imagine stopping urine flow. Also think of the hammock rising upwards, lifting as a result of the squeezing. You're going to hold for 3 to 5 seconds and then release. So some cues to make sure that you're doing this properly: to make sure that you're squeezing the pelvic floor muscles, make sure that you're not squeezing the buttocks muscles and not squeezing your abdominal muscles. It's all coming from inside and you're lifting the hammock upwards. So you're gonna train your pelvic floor muscles as if you're gonna train another part of your body, like your biceps, your glutes, or your legs. So this is a common condition that many women suffer from, that are often embarrassed to seek treatment for. Just know that you can get help and change that. If you have any more questions, come see a therapist at SNU Therapy. I'm Jerikka, physiotherapist from SNU Therapy, and remember, you're only one strategy away from crushing your fitness goals.